Hi everyone. I'm Emma Norman. I'm Catch 22, and I'm going to be moderating this workshop. This is the impact of COVID-19 on children and young people who misuse substances. Just some housekeeping for you. The session is 45 minutes. We're going to stick to a time as close as possible. There'll be a little bit of time at the end for you to ask any questions you have. If you do have a question, there is a Q&A section to the right of your screens that you can type your question in. Make sure that you're asking in the session tab and not the event tab, otherwise your question will be seen by everyone in the conference. And I will ask your questions to our speaker if there are any at the end, okay? If you want to ask your question live on screen, you can ask to share your audio and video, and I will bring you on screen as and when, if there's time. You can also use a thumbs up icon, which will show me that you would like that question answered. So if there's a question there that you really want to be answered, then please vote on it. So without further ado, I shall introduce Julie Poling, who is our Catch 22 service manager for our Hampshire 24/7 service. Julie has been with the service for a really long time, hugely experienced in the substance misuse field, and is now service manager. So Julie, I'll just hand it over to you.
Thank you. So I'll just share my screen with you. I'm not going to do this properly now, am I, now that it's time to go? Can you see that?
No, nothing at the moment, Julie.
I don't know what's happened. Right. Window. I don't know what's happened. Why it's not even coming up on my. Sorry.
It's all right.
Right, let me try again. Window. It's not actually showing.
Okay, hold on. Our message, it's Sarah Whitehead, isn't it?
Oh, hold on. That might be it now, is it?
Yep. That's your whole screen, not the presentation. Sorry, everybody. It worked perfectly this morning.
It worked absolutely fine last time. I don't know why it's not. Window.
That's it.
Oh, phew. Right, sorry about that. Slight technical hitch. Thank you for coming to this afternoon session. So as Emma said, I'm going to be talking about the impact of COVID on children and young people who misuse substances. So obviously I'm the service manager for Hampshire 24/7. We've got a number of substance misuse services across the country. The two substance misuse services that closely replicate each other are in Hampshire and Surrey. Unfortunately, our Surrey manager couldn't join us today, but both services support young people under the age of 25 who are involved in substance misuse and either need education and information on the substances they're using or need more specialist structured treatment to address their problematic use. And we work with a harm reduction approach with all of our young people to try and reduce the harm that is kind of caused by their substance use. So my contact details will be shared at the end of the session in case you have any questions at a later date. So hopefully the aim of the session is to increase the awareness and understanding of the impact of COVID on children and young people, and the outcomes are to understand the changes we have seen in children and young person substance misuse, the challenges we faced, what we started doing as a result of those challenges, what worked really well for our service users, and what we'll keep doing in the future after lockdown and hopefully long after the pandemic's over. So, as I said, in Hampshire, we provide both targeted and specialist substance misuse treatment services to young people. And we've had the contract in Hampshire since 2009. Most recently, we joined a partnership with Inclusion Adult Recovery Service in 2018. And at that point, our service moved from being an under 18 service to an under 25 service. And that brought some challenges in itself because the young people who were coming into the service were quite chaotic, and their substance misuse was often more entrenched. So just to give you an explanation about the different types of treatment that we offer. So targeted treatment consists of brief advice and guidance, including education on the substances young people are using. And this will include harm reduction advice. And we might do that in a one-to-one or a small group setting. And the idea of targeted treatment is to prevent or delay the harmful use of drugs in service users who are either most likely to start using drugs, so they might be high risk, come in a high risk category, or who are already experimenting or using drugs occasionally, but it isn't impacting their daily functioning. So they might be using at the weekends, they might be using at parties, but it's not impacting them every day. And then Public Health England explain young people with specialist substance misuse treatment as a care planned medical, psychosocial or specialist harm reduction intervention aimed at alleviating the current harm caused by a young person's substance misuse. So these young people are much more likely to be involved in maybe daily use, maybe poly drug use, so using more than one substance, and it is impacting on their physical, mental health. It could be impacting on their education, their ability to work, their relationships. And when young people come into that part of our service, they're often in a kind of crisis state. So they really need some intensive kind of intervention to try and reduce the impact their substance use is having on them. So just if you wouldn't mind putting some answers in the chat function for this. So what do you think the impact of COVID has been on young people's substance misuse generally? So if you've got any thoughts on that, if you could pop them in the chat and Emma will read them out for me.
Nothing yet. Nope. Increase in use.
Yeah.
Any other thoughts? Changes in available substances.
Definitely.
Increased use, more experimentation.
Yeah. Okay, great. Anything else?
No, that's all that's come through.
Okay, so what we've seen is what young people have reported to us. They've said they didn't have to get up for work or school, so it didn't matter if they were up late at night using or all night using substances because they had little or no structure to their day. They also said they had less alternative coping strategies, so things like going to the gym, being at school and being able to access the kind of emotional support they might get there, not seeing their friends, so really feeling like they don't have those coping strategies. For some, they found that it was harder to source. So equally, they might have found it difficult to source one substance, but could get hold of something else. So as was just said there, they might be experimenting with other substances because they can't get what they would usually use. So for example, we might see a young person who usually uses MDMA but couldn't get hold of it, and then they start using ketamine because they can get hold of that. them feeling isolated, as so many of us have. Really high levels of anxiety, so about COVID, but also about the impact that COVID's had on their family. They might be taking on some of the anxiety about parents not working or losing jobs, or and all of the things that come with that. Really being bored. A lot of young people cite boredom anyway as a reason to use substances, but even more so now. Having arguments with parents. So a lot of the young people that we work with don't spend an awful lot of time at home. I'm sure that goes for most teenagers, but it means that really being pushed together during lockdown and having to stay in the family home and perhaps not using substances has caused more arguments with parents. And there's been a lot of friction between parents and young people around having to stay at home, and the young people not wanted to do that. So it has caused increased arguments. They've just thought, what is the point in stopping? They haven't got anything else to do, so they've just carried on using, and some have increased. There's nothing else to do, so again, feeding into that boredom. Some said it was the only time that they would see their mates, so they might go out to meet their friends on a bike ride and smoke a joint while they're out. There were no other distractions. They really didn't have anything else to do, so not distracted by work or college work or school work, and not really knowing what else they can do, so just carrying on using. For some, their use has doubled or even tripled, and again, using different substances. On the other hand, some young people reported that they found it easy to stop because they weren't going out with their friends, particularly for those that had lower level use, that perhaps had wanted to stop using for a while, but felt they couldn't because they're part of a group who are using, and they found it easy. It was an excuse to stop using because they weren't going out. Some said it was just another thing to worry about. So on top of all the things that teenagers worry about, COVID, the lockdown has just given them something else to worry about. Some couldn't get hold of it, so had to stop. They didn't have a choice. And most of them saw that as a positive thing in the long run. Some said that they didn't think there would be help available. So for young people that go into school and have that emotional support of their teaching staff and the other staff there that support their emotional health, not having them to go to, some young people said they didn't think services like ours would be working. Having money but nothing to spend it on, this is really significant in those young people that were furloughed. So they had perhaps most or all of their salary, but didn't have anything else to spend it on. They weren't going out to the pub at the weekend. They weren't going out for dinner or having other things to spend money on. The shops weren't open. So they started drinking more, using more. And I think a lot of young people started drinking at home where perhaps ordinarily they would be going out to the pub to drink. They started drinking at home, and then it became a bit habitual. No one noticed what I was doing. So some young people were at home, their parents were still going out to work, and they really weren't picking up what was happening for those young people during the day. And those could use all day if they wanted to, because there were no restrictions. There wasn't school or college or work. And for some, they just said it helped them to forget what was going on. That's really common with young people anyway, but no, at the moment, it's been something that they've just wanted to forget about. So we also looked at the UK drug market response to lockdown restrictions, just to see if what we were seeing was what was being seen across the country. So the findings of this are based on 2,621 responses to Release's Coronavirus Drug Purchases Impact Survey. And they did that between April 2020 and September 2020. So the majority of the respondents did not report finding a supplier or a desired drug to be more difficult when comparing their experiences to before the start of the pandemic. More than 1 in 10 purchases were made on the dark web, and of these purchases, 13% of those respondents had not previously used the darknet to buy drugs. So that was interesting. Reports of prices being higher than they were prior to the pandemic were more frequent than reports of prices being the same or lower. So some drug dealers clearly cashed in on the fact that they may have been the only supplier in that area. Purchases of cannabis products were most commonly reported across all periods of the pandemic and equated to 7 in 10 purchases overall. And more respondents reported that their drug use had increased rather than decreased or stayed the same since the start of the pandemic. Responses captured the drug purchases made in anticipation of and during the first UK national lockdown, as well as purchases made during the easing and eventual lifting of this first national lockdown. The people that replied to this survey were 18 and over, residing in the UK, and were eligible to complete the online survey, and respondents were asked to describe a recent drug purchase. Now, what made us smile about this survey was in connection to almost 2/3, so 62% of drug purchases made during lockdown, respondents reported that their suppliers adhered to government-advised social distancing measures. There is evidence that some suppliers also adopted additional measures similar to those adopted by illicit markets, for example, accepting card payments and disinfecting cash in order to prevent further virus transmission. So they probably use that as a bit of a selling point that you can make card payments and we don't have to exchange money. Quite creative. So locally, these are kind of the changes we've seen. In the lower level substance misuse, some young people have reported that they've stopped using altogether. So those are the ones that would be accessing our targeted interventions. At the other end of the spectrum, some of the young people who are in specialist treatment reported that their use had increased. So we kind of had the opposite ends of the spectrum. There's been an increased use of alcohol, as I said, and some have said that that's due to the fact that they're drinking at home on a more regular basis. We've seen an increase in the mental health and emotional well-being issues. Certainly, alcohol has compounded some mental health issues for some young people because it greatly exaggerates the mood of the user. And we've tried really hard to educate young people around the use of alcohol and the links it's having to their mental health and emotional well-being issues during this time. And parents and carers support. So we've had more contact with parents and carers during the first lockdown. And that's often because they're suddenly faced with this increased substance use with their children and young people, or they've suddenly noticed changes that perhaps they wouldn't have seen had this not happened with their children being at home. We also saw an increase in self-referrals for the 18 to 25-year-old. And I was asking some of those young people whether they self-referred at the end of the first lockdown when furlough was lifted and they were able to go back to work, because we saw a significant increase during that period. And some young people said that, yes, they realised that they needed some support to get back to work because they'd been using much more than they expected. So just again, if you can just add to the chat, what you have found to be the challenges in your work roles. So thinking about from a staff perspective or from a professional's perspective, what have you found to be the challenges to work during the pandemic?
Moving from face-to-face to virtual offering, less personal contact.
definitely.
Isolation with home working.
Okay.
Any more for any more? No, that looks like it.
Thank you.
Oh,
So
hold
the
on.
challenge.
Lots of distractions.
Oh, lots of distractions. Certainly working from home provides lots of distractions. So the challenges that we faced are certainly delivering remotely. So going from a face-to-face service 100% of the time and moving initially to 100% digital and remote working was really challenging. We did have some young people that we continued to see face-to-face, adhering to government guidelines, but the majority, probably 95% of our interventions were delivered remotely. And that was challenging for a number of reasons, not least because some staff didn't feel confident in using the technology. So we've used everything from Zoom, Teams, Skype, we've used WhatsApp, we use email, we use text messages, anything that really helps young people to engage. But it's also meant that staff have had to be confident in their use of technology. I'm not very good at technology, as you saw at the start, but certainly having to deliver sessions over Teams or Skype really relies on the practitioner feeling confident to do that, not just using the technology, but being able to maintain a session throughout the time they're with the young people. It's been really difficult to engage new service users. So you have to work so much harder over video call or phone call to really get that young person to open up to you. I would say that we've actually done a really good job of doing this, and we've engaged lots of young people in treatment that we probably would not have thought we could engage over phone or video calling previously. And it's been tiring, but certainly staff have worked really hard to be able to do that on a level where they can really engage. Some of these young people are the hardest to reach young people, and it is about the skills of the worker to engage them that I'm most proud of, really. Supporting vulnerable service users. So some young people perhaps have language, speech and language barriers, so they're not able to use the phone, or they don't feel confident to use technology. So thinking again outside of the box about how we can do that and how we can overcome those barriers. And a big one for us was staff isolation. So staff have gone from working in an office where they see other members of the team every day to really working at home on their own. And we work in Hampshire, we work really hard to try and avoid staff feeling isolated. So we introduced regular team meetings, regular catch-ups every week. And we also introduced a buddy system. So everybody in the team has a different buddy every week. So we do it on a rota basis. And your buddy is the person that you catch up with, perhaps to have a cup of coffee over Teams, to be checking in with, making sure that each other are doing okay, and to even have a walk with. When we were able to, we started doing walk and talk sessions, and staff really benefited from having that buddy system. And then we did other things, like we sent cards and postcards out to staff just to say we're thinking of you, thank you for everything you're doing. And we also took Christmas presents out to the staff team. And I think that's really helped to cement the team. And I think now we feel closer than ever. Although some people do still feel isolated, of course, thankfully, not everybody's felt isolated at the same time. And we've been able to support each other and say, this has worked for us, try that. So a really challenging part of the last year has been recruitment and induction. So recruiting people digitally, virtually, not being able to see people face to face was a real challenge. And I was recruited into my and interviewed into my post during this time. So I know it's challenging. And actually inducting new staff, and we've inducted 5 new staff during this lockdown period. So we had to work hard at doing that as well. So not just working with clients, but trying to introduce new staff into the team. And in Hampshire, the team have been fantastic and really supported both myself and my senior in doing that. So I think it's important that we think not just about how we work with young people, but also how we can interact with staff and really make them feel part of a new team. So we moved everything to a new way of working. So we changed everything, as I said, to a digital offer. We changed all our resources. We upskilled staff so that they felt confident to engage with the young people, use the resources available to them. We also introduced a real flexible working pattern. So we know that working from home allows people to have more flexibility, but we looked at what individuals' needs were, and that might be that people had children at home that they were having to homeschool. So really changing people's working hours to enable them to do that. As I said earlier, we involved parents and carers more, so we might have spent more time explaining what strategies they could put in place for supporting their children, and really building on our resources. So we have a lot of resources available to us: workbooks, worksheets, leaflets, and trying to convert all of those so that we could use them digitally. And we were able to send them out to young people, workbooks, so that we had a workbook, they had a workbook, and we could complete them together. And that's really helped with that relationship building. Catch 22 also brought in a wellbeing charter, which was really well received. So the charter says that we will check in with each other and make sure we're all okay. We're one Catch 22 and we can lean on each other for support. We show compassion, and I think we do that really well. Things like lunchtime walks with your buddy, team coffees, restricted team screen time, yoga sessions, which everybody loved, book club, and any other activity that supports the health and well-being of the staff is more important now than ever before. And I think certainly my team have really appreciated the additional support that Catch 22 have put in place. Recognising that we're parents and carers and have busy family lives, so interruptions in online meetings, time blocked out in diaries to support homeschooling, or stopping by your isolated relative are not only acceptable, they're expected. Real recognition that people are not just workers, they're also parents and carers, and have vulnerable people in their lives that they need to support. We don't expect those working from home to be in meetings or on screens for the whole day. So reading, planning, and alternative means of communicating are fine. And lunch breaks are really important and shouldn't be skipped. We're all guilty of this. We are really guilty of skipping essential breaks and lunch breaks. And we've really encouraged people to put time in their diaries to do that, so that they have got time away and they are not just constantly going from meeting to meeting. Essential kit and resources can be purchased if you need something to keep yourself safe and well, or improve your working conditions. So we've bought things like headphones for staff to block out any noise they might have at home. We've bought fold-away tables, extension leads, anything that somebody needs to do their job better. We've looked to do that. So it might be collecting their screen from the office, or having their footrest or their chair at home, so they're really comfortable and able to do their job. And we will continue to champion the wellbeing of our staff and service users to our wider stakeholders. So sharing the kind of things that we've done with other agencies, it may well benefit them as well as us. And conversely, taking on board the things that are working for them. And certainly we've tried to do that wherever we can. So what worked for our service users? They said having regular appointments, so knowing that on Monday at 3 o'clock, I'm going to have my appointment with you every week. Having the option of telephone or video calls. So really saying, which would you prefer? And certainly when I take a referral from a young person, I always say, we're doing telephone or video calls, which would you prefer? And they will usually say telephone initially, but lots of them really like the video calls they have. And it's quite strange for us. We might have had telephone calls for some time with a young person, and you build up a picture of how they might look. And when you see them on the screen, they look very different and they think the same about you. So it's nice to now be going back out more to see young people and really get to see the person in the flesh. Being able to do interventions on text or WhatsApp messaging. So if young people really don't want to be talking on the phone or having video calls, we can also do those interventions. They're harder because you don't get as much information back, but certainly we'll do whatever it takes to engage with the young people. So being sent out workbooks or resources, as they would have if they were seeing us face to face, that's really worked well. Just having someone to talk to. Lots of young people live in very busy houses and they might share bedrooms with people, so there's nowhere that they can talk confidently and confidentially to somebody. So maybe going out on a walk and just having someone else to talk to outside of the family has really helped them. Knowing that someone cares. This is something that comes up all the time with our young people. And I'm really proud of the fact that my team care as much as they do about the young people they're working with. And that certainly comes across when you talk to young people and get feedback. Someone to support me with my drug use and someone to motivate me to stop doing drugs. And we really do focus on the positives, however small they might be, because that's what provides them motivation to keep moving forward. Knowing there is a 24/7 helpline makes me feel better. Even though I've never used it, I know that it's there if I need it. And most young people don't call the 24-hour helpline, but it is there. And having that kind of safety net, I think, gives them a bit of confidence. When at a weekend, that's when most young people are more likely to use substances. So knowing they can call somebody and have a chat just makes them feel better. My worker took time to get to know me and help me build trust. This is really important. No more now than ever before, I think, that we really do get to know the person and we can tailor then the support to that young person. Just feeling listened to, that's really important. Lots of young people say to us that no one listens to them, and I think that's another thing we do really well. And this quote came from some feedback from a young person. So in terms of support I've received, it was humanity that really reached me the most. Growing up with education at school and at home with my family, it was very much my fault and my issue, and a negative being taught about involvement with the police, etc. With your work, it was very much just a problem that needed to be resolved, not necessarily my fault or something I needed to or deserved to be punished for. So that helped me to confront it more openly. And I think for so many young people, drug use particularly is seen in such a negative way, understandably for lots of people, but that means that young people don't talk because they're ashamed. So being able to talk openly and honestly about their substance use really helps them to build confidence and trust in their worker. This is a fantastic piece of feedback from quite an older young person, so they were in their 20s, but I thought it was a great quote to include here because it really shows the impact of the work. So what are we going to keep doing after lockdown and perhaps when we return to some normality, whatever the new normal will be? We'll keep going digital, so having more choices for service users is really important. I think if you'd asked me 2 years ago if we could offer a complete digital offer to young people, I would have said no, that nobody would engage. Now we know differently. And for some young people, having the option to have a video call or a telephone call during their lunch break at work has really given them the flexibility to have those appointments where actually they might not want them after work, and we can do that during their working day. More flexible working. So for staff, take into account things like travelling in rush hour might not be the best use of their time. So really thinking about, do they need to be travelling a long distance to go to a meeting or to go to training, or should we be continuing to do some of the things we've done, like online training? Building online resources, so continuing to build on what we have and really making sure that everything we've got available, if you see somebody face to face, is available online as well. And taking the time to really reflect. I think it's something that we've done a lot of over the last year, really reflecting on what works, what doesn't work. We work in a really fast-paced, busy service, and it is not often we get time, certainly as a team, to reflect, and that's been really invaluable to us. And review and learn about how we can continue to support young people despite a global pandemic, and if these things happen again, how we can be ready if we have another lockdown, which I think at the end of the first lockdown we would have said we're not going to have a second one, but we have. So I think we need to keep all of those things in mind. So that's the end of the slides. I don't know if anybody has any questions now.
We do have a question.
Oh,
okay. So, in my role, digital poverty has been a massive barrier for young people who normally engage with us. Is this something you've experienced, and how have you tried to overcome this?
Yes, definitely. So, fortunately, in Hampshire, we've been really lucky to have a grant from the lottery with some COVID. It was linked to COVID funding, and we've supported a lot of young people in digital poverty. So we've been able to provide laptops and tablets and printers so that young people who perhaps lived in a family where there were multiple children and only one laptop, we've been able to provide the children with tablets or other laptops so they can complete their schoolwork. You're muted, Emma.
It's been a long day. Right. You can, if there are any other questions, you can ask to either share your audio and video or stick them in the Q&A. But if there are no more questions, we will bring the session to a close. I'll just give you a minute or two, or a second or two. No. Okay. So thank you, Julie. It was really informative and interesting, and I hope everyone that's watched it has got something out of it. So thanks for the question as well. It's really interesting thinking about the digital poverty and how we can sort of, once the COVID grants have gone, how we can try and continue to ensure that young people can engage digitally. So I think that's going to be an ongoing discussion. Euromet is now closed for the day after this session. You also have time to review the expo if you want to have a look around at some of the different stalls that are in the expo. If not, see you tomorrow at 9:30 on the main stage. Thanks, everyone.
Thank you.